Hey friends, welcome to Therapy Thursdays on Louisiana Living. We are Physical Therapy and Balance Centers. I'm Angela Yarborough and this is Dr. Jerry Yarborough. And we are coming to you from our Ruston location. We also have a Jonesboro, Louisiana and an El Dorado, Arkansas location. But we just wanted to explain to you what we're doing here and how we can help you live your life.
That's right. So here on Therapy Thursdays, what we're going to be doing is talking about different diseases and impairments that affect your quality of life.
And in the next couple of segments, we're going to show you exactly how that works and what we can do for you. But just remember, we're not here on TV just talking. We actually have physical locations that you can come see us. How does that work, Dr. Jerry?
That's right. In Louisiana and Arkansas, you have what's called direct access. That means you have direct access to your physical therapist. You do not have to have a referral, although we always work well with all the primary care providers around. And so just pick up the phone. If you need physical therapy, give us a call, and we'd love to help you love your life. Come back in the next segment and we'll get started.
Welcome back to Therapy Thursdays. We are Physical Therapy and Balance Centers. I'm Angela Yarborough. This is Dr. Jerry Yarborough. And last week we were talking about golfing and some injuries or some things that you need to know as golfers. So tell us, what kind of injuries can happen while you're golfing?
Right. So if you remember last week, Angela thought golfing was too leisure.
You had to bring that up, didn't you? You just had to bring that up.
Yeah, I just want to remind you guys of that. But actually golfing is very physical and can lead to many impairments. If you don't follow that SMART acronym we talked about last week, if your muscles are real tight and you're not ready to start performing, you can definitely have lots of injuries. With the movement that golfers make and the twisting that they make, they can have a number of injuries, all the way from their feet on up. Ankle injuries, knee injuries, low back injuries are very common. But you can also have shoulder injuries, elbow injuries, wrist injuries, and even neck injuries. I'm pretty stiff, so whenever I was practicing to try to learn how to play golf, really my neck told off on how stiff it was. So golfing is a total body activity. The impairment that we're talking about today specifically is going to be called golfer's elbow. Now it's called golfer's elbow because many people that play golf get it, but there's so many different activities that can actually cause golfing elbow. And it's right here. So if you have tenderness on that medial bone of your elbow right there, that's what golfer's elbow is. And it's actually caused from a repetitive use, okay? And improper muscle preparedness. So again, it's very important that we work on the flexibility and the strength and proper form and everything else to prevent injury to our elbow. And so like I said, we're going to specifically talk about that. It is the muscles of the forearm that actually do wrist flexion that attach to a common tendon here called the common flexor tendon, which for those that don't know, muscles attach to the tendon, which then attach to the bone. And it can get really tight and inflamed and cause you a lot of grief there. Again, it's repetitive use. So people like if you're shoveling a lot, many of us don't do that regularly. So if we get out there and do things like the weekend warrior, you're not used to that. Hammering, so a lot of construction guys can get golfer's elbow. Of course, golfing can cause that. Anything which you're putting a lot of stress on those flexors, it'll get really tight. It can cause multiple micro traumas in there, and that tendon will actually become fibrosed or very stiff with a lot of scar tissue even. So, through a thorough evaluation by your primary care provider or your physical therapist, we can determine exactly what's going on. Now, physical therapists are going to treat it not with medicine or injections or surgery. We're going to treat it conservatively and teach you the RICE method of rest, ice, compression. Instead of elevation, it's exercise. So come back in the next segment and we're going to get more into that. Hey guys, welcome back. I'm Dr. Jerry Yarborough, physical therapist and owner of Physical Therapy and Balance Centers. And today we're talking about golfer's elbow. And we have Aurelio with us today. And he's one of our physical therapy techs here. He just graduated with his kinesiology degree from Louisiana Tech. So he's the expert. And so remember, golfer's elbow is repetitive use of the flexor forearm muscles, okay, in here. Now it's called golfer's elbow because many golfers can irritate that area because of their swing and the tension and everything in here. But many other people can be affected with golfer's elbow. Carpenters using a hammer, anyone shoveling a lot, any kind of repetitive work in which you're using the flexors here. Now all these muscles attach to a common flexor tendon which attaches to the medial side of your elbow. And it can get inflamed or it can get a buildup of scar tissue known as fibrosis. Okay, so for your takeaway today, if you have pain here, then you more than likely have golfer's elbow, okay? And things that you can start doing immediately is ice. First of all, you want to use ice to calm things down, okay? And then you want to do some gentle stretches. You're going to do a wrist flexor stretch. All right, that should feel real good in here. Remember, with all stretches, guys, you only do them for about 30 seconds, 3 times for 30 seconds, and you never go into a lot of pain. You should go to your end range, gentle stretch. Hold it for 30 seconds, do it 3 times. All right, we did the flexors, now do the extenders. Okay, and then also you can use your hand, you can use a ball, anything like that. You're gonna actually press in there and really mobilize that tissue, okay? Now I want you to do that for at least a couple of minutes and really get in there, and that should feel really good. It does on me. All right, so we want to do a good stretch, and then we want to strengthen those muscles, okay? So at home, you can grab a can of vegetables or something like that. They're normally about a pound. So you can do some wrist flexion strengthening like this. You can turn it over and do some wrist extension strengthening. And then going back and forth, doing some forearm rotation, pronation, supination there, okay? So those are some good takeaways, guys. If you're hurting here, golfer's elbow more than likely, any pain more than a couple of days, you need to go see your PCP, or you call your physical therapist and either one can evaluate you. Thank you for being with us today. We'll see you next time.